Experts say that it's wise to be aware of potential problems if you're taking multiple medications. Some drugs can cause harm if taken for years, while others stop working or interacting badly with a new drug. University of Toronto pharmacist Lisa McCarthy says you can ask your pharmacist or a doctor for a review of all of your prescriptions. If you choose your doctor, Ms. McCarthy suggests dedicating an entire appointment to the review rather than trying to squeeze it into the final few minutes. Here's my earlier conversation with Dr. Abhishek Raut.
Great to be here.
Now, what are some of the most common prescriptions that negatively interact with each other?
Well, we've got a lot of common prescriptions that interact with each other. I think the big ones that we see quite often are blood thinners and anti-inflammatories. So you might be on a blood thinner like warfarin, but you might also be taking things like ibuprofen or things that are over the counter like that, which can definitely increase the risk of bleeding. We also see quite often antidepressants and other serotonergic drugs. So antidepressants or SSRIs specifically can have a lot of different effects when combined with other medications like migraine medications or tramadol, and it can increase the risk of serotonin syndrome. The other most common ones we see are antibiotic interactions. So a lot of antibiotics, such as clarithromycin, for instance, can certainly have interactions with statins, which help reduce your cholesterol. And those in combination can sometimes increase the risk of muscle damage as well.
And is the risk of drug interactions made worse in Canada because many Canadians don't have a family doctor? Or even if they do, they also rely on clinics for appointments around the availability of their family doctor?
Yes, I think what we see here is lack of a family doctor certainly causes fragmented care. And when you have that, it's very difficult for one person to really know all of the medications that the patient is taking. We're also talking about communication gaps here. So if a patient is seeing multiple healthcare providers, there will be inevitably some gaps in information on what are the medications they're taking. We also see some other risks as well. So polypharmacy is much more common in older adults who are more than likely to be on multiple medications, and they're at particular risk as well.
And how do drugs change in terms of impact if they are taken for a long time?
Yeah, so as you alluded to earlier as well, tolerance, I think, becomes a big part of this. The body can become accustomed to a drug, and then you need higher doses to get that same effect. There's a dependence that can come from long term use as well, which means the body is going to rely on the drug to really function normally. Side effects can also start developing. Anti inflammatories are notorious for giving you gastrointestinal issues or ulcers if you take drugs like ibuprofen for long periods of time. And finally, the drug interactions, even though they may not interact or give you a strong reaction initially, if you take both of those drugs or multiple drugs for long periods of time, you start seeing those interactions develop with time.
And is it common for patients to take medication longer than they are supposed to or need to?
It is very, very common. What we see is basically stemming from a lack of follow-up. So patients may not have regular follow-up appointments with their doctors, so they're not sure on how long they need to continue the medication. Some chronic conditions, of course, we use medications indefinitely, but without a proper periodic evaluation, it's hard to see whether that medication is actually useful at that point.
Now, you mentioned patients becoming dependent on certain drugs, but when patients stop taking certain prescriptions, can they experience symptoms like withdrawal?
Absolutely. So we do see patients experiencing withdrawal-like symptoms when they stop certain medications, notoriously antidepressants. So stopping antidepressants like SSRIs or SNRIs can lead to a lot of withdrawal symptoms like dizziness, nausea, headaches, and mood swings. We call this antidepressant discontinuation syndrome. We also see it in benzodiazepines, which we use for anxiety and insomnia. And when you stop those medications, a lot of patients actually have much worse anxiety and just can't sleep. So we definitely see withdrawal symptoms quite commonly in the field.
Now, it is trending that a lot of people are seeing medications on TikTok or social media and are mixing these vitamins and medications with one another. What would you say to young people looking at these videos and taking these medications and how careful they should be with things like this?
Yeah, I think we should be very careful with medications in general there. There certainly are trends that come and go based on that. I think the big piece of advice would really be that there is a pill for every ill, but there's also an ill for every pill.
Thank you so much, Dr. Oat.
Thanks so much for having me.